Hi, I'm Dr. Munshi. In this video, I'll talk about which restoration is best for non-carious cervical lesion or cervical abrasion. Is it composite resin or glass ionomer cement? You all know, guys, that what is cervical abrasion? It is due to faulty brushing, and the most affected tooths are molars. So most of the time, patient comes to your clinic with sensitivity, and while diagnosing you may find that the cause of sensitivity or pain is cervical abrasion. So which restoration is best, composite restoration or glass ionomer cement? You must have to know, because it's a question of treatment. So you have two options or other options also, different modified GIC, modified resin, composite resin. I'm not discussing about that all. I'm just focusing on composite resin and glass ionomer cement. So the most important thing that we have to keep in our mind, that we have to relieve the patient's sensitivity, or we have to relieve the patient's clinical symptoms. So the material which reduces the symptoms rapidly and stops the sensitivity, that will be the best for cervical abrasion. So which material is it? Is it composite restoration or GIC? In my experience, and also some studies you can find in Google, it is GIC. Yes, for comparison these two, I have done one side cervical abrasion restoration with composite resin and one side glass ionomer cement. Same type of lesion, but patient was more comfortable with GIC, and I did both type of restorations in different patients. The result is that GIC is the best for cervical abrasion for reducing the symptoms. Not only reducing the symptoms, but also the retention is also good, comparatively better for GIC also. But if you want a tooth-like surface and the absolutely perfect tooth color, I think composite will give you aesthetically correct color. GIC will not give the exact color of tooth, though different shade of GIC is available. But for that purpose, if the patient is not complaining about sensitivity, then you can consider GIC also, composite resin also. But if patient is telling about sensitivity, and that time the GIC is best in my opinion. You can do both in different patients, and you can have your own knowledge that is gained by your experience. So this was my view. Please comment what you do in your clinics and what are the results. Thank you very much for patience listening. Bye.